Well, good evening, everyone, and welcome to Mindful Living with Arthritis interactive webinar. My name is Heidi Sittelmeyer, and I'm the Director of Online and Community Connections here at the Arthritis Foundation. I'm also a patient, and I've been living with juvenile arthritis for well over 50 years now, and I also have osteoarthritis and osteoporosis. Like many of you here tonight, I've tried alternative therapies to help manage my arthritis symptoms, including acupuncture, massage. I've dabbled in Tai Chi and yoga. I love hydrotherapy and water exercise. And mindfulness is one of those things that I've tried on occasion, but I just haven't managed to build a muscle around it. So I'm super excited for this webinar tonight because I really want to integrate mind-body practices into my program on a regular basis. So I am definitely looking forward to what we're going to learn tonight. So as we know, there definitely is no shortage of stress to go around, especially this past year. Hopefully 2021 will be a little less chaotic. And I think we can all agree now more than ever, it's so important to have tools to help us cope when things get tough. Our guest experts tonight will help us understand the science behind using mindfulness meditation for arthritis and stress management, as well as demonstrate practical, easy ways to apply it in our everyday lives. Ultimately, events like this one are informed and driven by patients like you. Our goal at the Arthritis Foundation is not only to raise awareness about the challenges of living with arthritis, but also to collaborate with leading health experts to provide strategies and support that will help you thrive. To do that, we need your help. With your input, we can create more educational tools, resources, and programs that will speak to what's really important to you and help you live your best life. That's why I'd like to share a short video with you to tell you about the Insights program so that you can make your voice heard and help us create more programs like this one.
By taking part in the Live Yes Insights Assessment, you help change lives today, including your own. And you help change the future of arthritis. It takes just 10 minutes or less to share your experience and make a difference. Answer simple questions, like how often you felt arthritis pain in the last week. Ongoing insights data from people like you will lead to new resources that ease daily life. Your insights show what kind of support you need in your community. You improve the healthcare system. You focus researchers and others on top priorities. You'll make more research funding possible, leading to new groundbreaking treatments. The power is in your hands to change things now and for the future. This is your opportunity to change the future of arthritis.
So just a note, we recently launched our JA Insights program. So if you're a parent of a child with JA, we strongly encourage you to enroll in this program as well. Before we begin, a few housekeeping notes for tonight's event. We have muted all attendees for this event, but you can direct any questions you may have throughout the presentation in the Q&A box at the bottom of your screen. We'll reserve time to answer your questions during the presentation and at the end. This webinar will be broken down into two parts. The first part will be led by Dr. Rael Cahn of the University of Southern California Center for Mindfulness Science. He will provide an overview of mindfulness and the research for its application in pain management and other arthritis symptoms, as well as overall health. In the second part, Alex Maizuss, Program Manager of USC Center for Mindfulness Study, will guide us through an interactive demonstration with a patient panel. She'll also discuss easy ways to apply mindfulness in your everyday life. After tonight's session, you will receive an email about your experience tonight. These surveys help us to track how the success of these sessions and better plan for other events in the future. So let's get started by introducing our first guest, Dr. Rael Cahn. Dr. Rael Cahn is an associate professor of clinical psychology with the University of Southern California's Department of Psychiatry and Behavioral Science, and the director of USC's Center for Mindfulness Science. Dr. Cahn has been researching and publishing on the clinical and brain effects of mindfulness and meditative practices throughout his medical and scientific career, as well as teaching mindfulness meditation in group settings for medical professionals and patients. He is affiliated with the USC Brain and Creativity Institute, where he conducts psychological and brain research in the domains of behavioral and psychological interventions, including mindfulness and meditative practices for dealing with everyday stressors, as well as depression and anxiety and substance abuse disorders. Dr. Cahn, welcome, and thank you so much for joining us today.
Thank you so much, and thank you for the invitation to be here and the introduction. I'm going to share my screen so I can share some slides with everyone. Here we go. So, I'm going to be speaking about mindfulness and some of the research. And there's really been an explosion of research in mindfulness over the last 20 years in my research career. So it really seems appropriate to offer it specifically for people who are struggling with arthritis, because many of the areas where mindfulness interventions, mindfulness practice has been shown through research to be most effective are really very applicable to arthritis. And I'm speaking specifically about stress, pain, and inflammation, some of the really kind of core aspects of the condition of the arthritis. So I'm going to speak first about what is mindfulness. And within the psychological literature, our understanding that there is such a thing as mindfulness has grown quite a bit. When I first started studying psychology and neuroscience about 30 years ago, this was really an area of research that was very undeveloped. It wasn't actually until the mid to late 80s that mindfulness was even defined as a term within first the kind of mind-body medicine field, and then later in psychology. Now in modern psychology, it's really one of the key features of the marker of well-being of somebody who is experiencing a level of psychological health. So there are many different scales that have been developed over the years. These are some of the names of the scales to measure mindfulness. And the fact that there are so many scales points to the fact that it's really become an active area of research interest. Some of the key aspects that are denoted by the notion of mindfulness as a trait are the tendency to act with awareness, to be aware of what we're doing, to be aware of our body, to be aware of our emotions, and to be aware in a specific way, a non-reactive, non-judgmental, and accepting way. So you can think of it as a state where you do your best to moment attend to what's actually happening here and now, being with things exactly as they are without escaping into thinking about how you wish they were different, or the past or the future. And you can also think of it as this trait, this tendency towards being aware of your thoughts and emotions, your feelings, the tendency towards being aware of what's in awareness, this idea of meta-awareness. And to be aware in this way that's non-reactive, not identified with the thinking process, but kind of aware that the thinking is happening, and so is a lot of other, there are a lot of other things happening moment to moment. So it's kind of having that spacious awareness within which thoughts are occurring and the body is experiencing its sensations. And then in addition to this state and the trait, there are the specific practices that we now know. If you engage in these practices, you can help grow your capacity for mindfulness or your tendencies for mindfulness. So we'll be doing some of those. Alex will be leading some. There's concentrating on the breath and really bring attention moment to moment to the sensations of the breath, or engaging in an open awareness kind of practice. You can also engage in a mindful way with movement, doing slow yoga or walking. And we'll talk a little bit more about that when we get to the practical. Okay, yeah. So just talking about what mindfulness is, which is always a difficult thing because really it describes a quality of mind. And so talking about it doesn't really get you there. But it can help thinking through what this quality of mind is a little bit. So this capacity for acting with awareness, bringing awareness to what's happening in your body, what's happening in your thinking process, and in a way that is non-reactive and non-judging, just really being with what is. And one of the confusing things about the term is that it's used both to describe a set of practices that we know will help grow the tendency towards being mindful in life, engaging in mindfulness practices. But it also describes a particular state of mind or a trait of a way of interacting with the world. So the state is usually described as this present moment, non-judgmental, accepting awareness, being aware of what's happening moment to moment in a very non-judging, non-reactive, and accepting way. So you could think of it as just really being with what is, just as it is. And the trait is that capacity to be aware, to be more aware of your thinking, your emotions, your feelings, not on automatic pilot, but actually present and engaged with what is happening in your body moment to moment, in your thinking moment to moment. And this kind of non-reactive, non-judgmental, like having the capacity to respond instead of react by becoming more aware of those tendencies to react and choosing the way that you actually want to interact. And there's this process of disidentifying with the content, so not being so fused with our thoughts, but instead having a little bit of distance and noticing our thoughts. And the practices, we have sitting practices, which we'll engage in. And they involve first learning to concentrate the mind on something other than our thoughts that tend to be where our mind concentrates if we don't intervene. To really cultivating an open awareness state where we are observing without being kind of attached to the full range of experience and the sensations of the body and the sensations of the mind, the thoughts, the tendencies of reaction. And you can engage, of course, with mindfulness practice in a formal way while sitting or laying down, or even while engaging in movement. Tai Chi or walking. So I'll talk a little bit about some of the models that psychologists studying mindfulness have come up with. This is a model looking at mindful coping, the model for how mindfulness is a tool to help with more beneficial coping with stress. So stress happens in life and we have a response. We kind of appraise, well, what's the stressor? And then there's this capacity we have to be not so kind of focused in on our reaction to what happened, but instead to notice the tendency, what the reactive tendency is. So kind of decentering from our reaction, instead watching. And you see, oh, there's a kind of mindful state you can get into, and the broadening of attention, being able to reappraise whatever the stressor is in a way that doesn't cause so much burden. And this leads to a greater access to some positive emotion, a reduction of the stress. And this is a model for how mindfulness in this way helps with coping. Another model for mindfulness is that we start with awareness and then go to regulation of the self, and then finally to kind of transcending the sense of self. So we start really just applying this unbiased awareness, being with what is, moment to moment. And first you start really short bursts, and over time you can sustain it for longer in formal practice. And by doing that, you're also noticing those tendencies to be reactive and regulating them, not acting in a reactive automatic way, but instead becoming more conscious and choosing. And in that whole process, you disidentify with some of the narrative processes that are going on as you become less kind of automatically reactive. And there's this tendency that has been observed now in the scientific study of psychological reactions to engaging with these practices, of becoming a little bit more focused on the interaction with the world, not as focused just on your own needs, but on the needs of others, and a kind of transcendence of the ego to some extent. And then a really basic kind of attentional model is this emphasis on non-elaborative awareness, just an open orientation to experience. So we are really working with the capacity to put our attention where we want it to be, and in particular, a non-reactive, accepting form of attention. And this particular model also, you can look at it with the basic kind of attentional cognitive mechanisms, all the motivation and intention, expectation, and attitude that goes into why we start engaging with mindfulness practices. And then those key features that engaging with a mindfulness practice involves, being really attending to what we choose to attend instead of just where our attention goes on its own. And having that cognitive flexibility to bring it back when, for example, the mind wanders off the awareness of the breath and into thoughts about tomorrow, or the stressful thing that just happened on the news, or whatever it is, bringing it back just to being present with the body or the sensations of the breath. And then noticing the tendency towards emotional reactions, and bringing back from a sense of automatic reactivity to noticing, oh, that's what this kind of body response is right now, but that's not something I have to act out. So this flexibility, and this all contributes to a non-judging awareness capacity that then changes our behaviors. And it turns out also our brain and the bodily processes from the physiology and the kind of genetic expression of ourselves. So getting a little into the neuroscience, which is an aspect I spend a lot of time investigating, there are these networks that support these different aspects of attention that are engaged by mindfulness practice. So as one is sitting there focusing, for example, on the sensations of the breath, everyone experiences the same kinds of things. We have different varieties, but the same basic thing is, if you try to sit down and do that, before long, maybe milliseconds or seconds, your mind has wandered off and is not at all with the breath. And then there's this recognition, the attention, you kind of catch yourself. Oh, I've wandered off, and re-engaging, letting go of the engagement with thinking or whatever the kind of fantasy might be, and re-engaging with the object of the awareness of the breath. There could be other kind of focus of awareness in different mindfulness practices. It might be the body as a whole, or the awareness of the thinking, not the engaging with thinking, but awareness of what thought is coming up. And in any case, it engages these different networks as you become aware of the fact your attention has wandered, and you redirect your attention. And unlike a lot of other things where we have kind of a kind of interaction with the stimuli of the world, all of this attentional tuning is happening all within ourselves. So it's a very refined way of, as Haiti put it at the beginning, building the muscle of mindfulness involves building this muscle of the mind and the brain to regulate the attention in the way we choose. And there are a whole number of networks that we see are engaged and disengaged in each of these steps of kind of fine-tuning one's attention. Networks that are more about the experiential self of the body, sensation, networks that are more about the narrative self, the thinking process that kind of goes on all the time in the background. But we turn out to have some capacity to relate to it in a different way and for it to transform through these kind of practices. So one of the key networks that's been identified is this network related to the narrative process, the abstract thinking that is such a big part of our mental life. And it turns out that this network, the default mode network, is quite active. And whenever we're not kind of really engaged with something or another, or even if we are engaged, the mind wanders and that network becomes more active again. And it turns out that meditation, mindfulness practice really seems to target this network. An example of how this network is engaged is if you ask people in a scanner environment where you're measuring the blood flow of the brain to attend to words for their meaning, what it means to them, versus just what they feel when they see the word. The attending with meaning engages this network, these kind of areas that have written up the default mode network. And then if you look at people after just 8 weeks of mindfulness training versus those without it, you already see that there's this capacity when engaging with stimuli in an attempt to just feel their impact instead of to think about them, that after mindfulness training, this network, the default mode network, is much less engaged. And in addition, some of the networks of the brain that are more about cognitive control or the capacity to kind of put your attention where you want it, in red here, those are much more engaged. So this is just one of the many studies that is starting to look at how the brain changes in support of this capacity to be not so caught up in our thinking and instead to have more choice about where our attention is moment to moment. Another similar study was published looking at with a cognitive task where you have to kind of really attend and respond using these kind of tricky rules of, are you responding to the numbers or the number of numbers, and then some distractors that are these really intense images. How does the attention change with a 6-8 week mindfulness intervention, and how is that reflected in brain activity? It turns out, well, this is repeated across many studies now, there's a real tendency towards attentional improvements. So engaging with these practices enhances one's attentional capacities so that, for example, one is more accurate with this task, and you see less of a slowing down when you have kind of conflicting information that you have to process. And this was just, a randomized controlled trial comparing a group that went through mindfulness to not, showing these differences. And at the same time, some changes in the brain. So this key node of the network of cognitive control that kind of directs attention where we want it to go is more engaged during this kind of distracting, difficult task after mindfulness training compared to folks who are assessed pre and post without doing the mindfulness. And one of the interesting things that really is related to, pain also, as the next few slides will show, is that there's also this enhancement that people who practice more tend to show an engagement of the feeling center of the brain. So the feeling center, which is called the anterior insula, I'll try not to use a lot of technical terms, but it's a term that comes up a couple times. It's kind of the feeling center where the brain is active in response to how the body is feeling moment to moment, encoding the body's sensation moment to moment. And it turns out that part of the brain becomes more active through mindfulness as one becomes less kind of wrapped up in thinking and a little bit more attuned to the body. And then a kind of related study, a couple of studies that I wanted to highlight that show some of these brain changes about increasing the kind of cognitive engagement and control modules of the brain seem to be related to some of the really important physiology underlying pain and suffering generally, and particularly related to arthritis, this inflammatory marker. So this was a study where they looked at folks before and after a kind of mindfulness weekend, intensive weekend of some mindfulness training for beginners. They showed that the kind of cognitive control network was more in communication with the default mode, kind of decreasing its tendency to kind of go off wherever it wants, instead kind of a little more hooked up to attentional control. And the degree to which that increase of the kind of cognitive control communication with the default mode network was related to decreases of inflammatory marker called IL-6. And of course, inflammation is something that we now know it's not just in arthritis and other kind of classic inflammatory conditions, but really everyday stress is associated with some degree of inflammation or depression, different psychiatric illnesses. So it was really of general relevance. And another recent study, this time in folks with cancer going through a mindfulness intervention, they found and this just came out a few weeks ago, it's such an active area, but starting to hook up, some of the changes of brain activity to the changes of inflammation and markers of bodily well-being. Here they looked at response of the brain to angry faces versus pleasant scenery, and saw that comparing pre and post the mindfulness training, there was a decrease in the kind of fear center reactivity to angry faces in the scanner. And at the same time, an increase in the reward center activity to pleasant images. And the degree to which the brain became more attuned to and kind of showing this reward response to pleasant images was associated with decreases of some of these classic inflammatory markers, IL-6 and CRP in this case. So again, showing this retuning of the brain, in this case related to our ability to kind of gain appreciation for what we are experiencing more moment to moment and have some sense of reward, seems to be related to the balancing of some of the body's inflammatory dysregulation. And now getting right to the heart of the pain. There have been a number of studies both on subjective perception of pain, as well as specifically how pain is responded to in a neuroimaging environment to see how does the brain respond to pain and how is it changed through mindfulness. And there's a study showing even short-term training over the course of just a week or two, regular practice with painful stimuli applied in the scanner environment. You see that those who went through the mindfulness practice have a decrease in the intensity of their pain and the degree to which it's unpleasant, these two aspects of the intensity of pain, and then how unpleasant is that pain right now. And as many of you will probably recognize, depending on your mood, sometimes the same intensity of pain can be more or less unpleasant. And that's really one of the things that mindfulness is first starting to do, is to disentangle the sensation itself from our reaction and response and the kind of unpleasant evaluation of the pain. But both of those things are reduced through mindfulness, especially the unpleasantness. And it turns out that some of the key areas that are responsive to sensing body sensations and pain in particular are actually increased after the mindfulness training in association with a decrease of the pain intensity. So kind of counterintuitive, but related to the notion that we are becoming more attuned to the body sensation, not turning off or becoming less aware, but more aware. It's just that in that process of becoming more aware, we're also becoming more accepting. And that may be mediated through the kind of control networks, this frontal area that is called the OFC here, that also becomes more active in association with the decrease of the unpleasantness. So one more measure of this kind of cognitive control enhancement that helps to tamp down the unpleasant of these kinds of stimuli in the environment. And then looking really just directly at inflammation, we see that there's a reduction at the genetic level in the expression of inflammatory genes. This is a very busy slide, but the bottom line is that a number of these genes that are related to the expression of inflammation in the bodily tissues are actually decreased in their expression just over the course of an intensive day of meditation, pointing to the fact that probably if you engage in these practices over the long haul, there's going to be some effect as well. And the last few slides is really just kind of a summary, looking really just at those studies that have assessed rheumatoid arthritis and other arthritis conditions, showing that, you know, these clinical trials do reflect some of the findings that I've overviewed here, that there really is a tendency towards reductions of stress, pain, and increases in functional status, the capacity to engage with life, challenges and circumstances. So from the very early studies that John Kabat-Zinn did on the mindfulness-based stress reduction technique that he developed back in the 80s, where he found the effects on chronic pain were some of the most dramatic benefits, to the more recent ones in the last 10 to 12 years, looking at chronic pain conditions and showing improvements in stress, depression, well-being, and pain. And I'm just going to wrap it up with, these are a couple of just additional studies looking at rheumatoid arthritis specifically, showing these improvements that are already evident in this case after a couple of months, but then at 6 months become very evident, comparing the two groups on depression and psychological distress. And one last thing I want to bring attention to is self-compassion. And I'm going to end here. Self-compassion turns out to be a really key component of how to engage with mindfulness practices in the most effective way. And it turns out that it's reciprocal. If you engage in mindfulness practices, one's tendency towards self-compassion will naturally grow. If you engage kind of purposefully in a more self-compassionate way, mindfulness will tend to grow. So the notion of self-compassion is self-kindness versus self-judgment, experiencing our common humanity versus our sense of isolation, and experiencing this ability to kind of be not so identified with our thinking and our reactions, and instead being in this space of a kind of non-reactive, even awareness with what is moment to moment. So that's it. And I would like to turn it over to the next presenter.
All right. Well, thank you so much, Dr. Cahn, for helping us break down the basics of mindfulness. I've certainly learned a lot, and I'm fascinated to hear all the ways mindful meditation can not only affect our moods, but also our physical health. Before we move on to the practical demonstration, let's take some time to review some of the incoming questions we have so far. So I've got a two-part question for you. If I want to set myself up for success with a mindful practice, what are 2 things I need to know or do before getting started? And then the second part of the question is, what are the top 2 triggers that derail mindfulness, and how can I avoid them?
Well, you know, it can be very individual, one's path through engaging with mindfulness practice. So anticipating what are the 2 most important things for any individual is, you know, I'd have to be a better mind reader than I am. that being said, I think a couple of things to really keep in mind, and I think Alex will probably speak about this, who's going to be leading us through some practices momentarily as well. But it takes a sense of commitment. Even if it is just 5 or 10 minutes a day to start, that is a real change of pattern to devote to oneself in this really unusual way of taking some time, no distraction, just to be with oneself and just to attend to the inner world in this way. So I think acknowledging, it's going to take a real commitment, and oftentimes at the beginning, one way to help accomplish a change of this kind is to have a discussion with those people in your house who your change of a pattern will affect, and get some sense of alignment that they're okay with that, and also set some time. A particular time of day, oftentimes kind of early in the morning, can be good, but it doesn't have to be that time. Some time where you're alert and you're able to stay engaged, attentionally engaged. There's one thing about mindfulness that can be, a hindrance, as that second part of the question pointed to, is the tendency towards just kind of relaxing and falling asleep. And it's natural. Sometimes that will happen repeatedly as you engage in mindfulness, and it might be a sign that you need to get more sleep. But in the end, this is a very active process of building a certain attentional capacity of the brain and the mind. So just as with working out, you need to kind of have a bit of energy and alertness to engage in this way to start that transformation happening.
Great. Okay, next question. Mindful living for me, like autonomous driving vehicles, most in the system need to be on the same platform to avoid collision. How do you cope in an environment where others in your life are not in tune with mindfulness?
One needs to accept that things are as they are. There's that saying from Alcoholics Anonymous, accepting the things that you cannot change, and so engaging with mindfulness, there's going to be a slow but subtle change in your kind of way of relating, and that may be a little bit off track to how some other people in your life are relating, but in the end, everyone has a different amount of mindfulness even without engaging in these practices. So it turns out when you look at the range of how people score on mindfulness and some of the related kind of emotional regulation and awareness, some people are just lucky. You might be a very mindful person without ever having practiced, but of course you can build your muscles. Somebody who's born with a lot of muscles, you can still get more strong by working out, and that's the key, is to relate to it like it's just a human tendency. We all have some or less of it, some more of it, and probably less stressful times. But by practicing in a really concerted, intentional way, we can build the capacity for bringing more mindfulness even to those more stressful times, and in the face of environment where maybe there's a lot of people on automatic pilot who are not acting mindful at all. But that's just one more thing happening in the world. Like with everything else, we can deal with it and respond to it in a mindful manner.
Great. I hear acceptance and compassion. All right.
Absolutely.
Do negative emotions like resentment cause more pain in the body? Can mindfulness help resolve these negative emotions and help me practice forgiveness?
Yes, we now do have the research that backs up this kind of intuition that probably many people have, or you might have just lived it, like, wow, when I'm really feeling those negative emotions, my pain is worse. And I think part of it does come to this notion of acceptance and compassion are really the antidotes for a lot of the negative emotions. It's when we're not accepting things that we develop a sense of desire for revenge or anger or sadness oftentimes. or we're just not being kind to ourselves. We can have the negative emotions of judging ourselves, etc. So the bottom line is, yes, working with attention in this way will, have a real effect on the emotional field. And it's kind of the emotions in combination with the building of these attentional skills that, together probably help with the improvements on the experience of pain.
Great. Our next question. I have ADHD and meditation is hard for me. Can something creative like playing music, writing, or painting also give me the benefits of a mindfulness practice?
I have two things to say about that. One is that engaging in some of these formal mindfulness practices has been shown to really benefit ADHD symptoms. And yes, the pure sitting practice may be a little more difficult for somebody, especially if there's a lot of restlessness associated with their ADHD. So engaging in mindful walking or mindful slow yoga, some kind of mindful movement might be a good way in, while also checking in, with some sitting practice every now and then to see if maybe you're developing a little more patience to engage that way. Engaging with other creative pursuits, there is a chance that any creative pursuit that kind of allows you to really get into the flow may help with your mindfulness. That is something that, because this is still a relatively new field, we don't have a real sense of, the comparative efficacy of some of the more formal mindfulness practices versus some of the more kind of beneficial practices that we know are good for our mental and emotional well-being, but are not mindfulness per se. What effect do they have on mindfulness? They may still have some effect on mindfulness. It's true.
Great. Another question. I find it difficult to cope knowing my RA is a lifelong condition that will limit my routine forever. How can mindfulness help me deal with this difficult reality?
One aspect of engaging in mindfulness practice is this deep acceptance, and living with a chronic illness is one of those kinds of things where really deep and challenging acceptance is probably one of the core gifts that you can give yourself. And it's much easier said than done, of course, but it is the kind of key aspect to how to engage in the practice, is being really okay with everything as it is. Of course, you're going to engage in life in ways where you're doing things to, accomplish those things you'd like. But for the time when you're engaging in formal mindfulness practice, you're just giving up the sense that anything is wrong here. There's just a deep acceptance. Things are as they are. And that acceptance is the kind of leverage point around which some real transformation can happen. And until you really give it a try, it just sounds like some words. But I can say, having spoken to a lot of people, it is a phenomenon that you can experience in yourself.
Great. And our final question, and then we'll move on to the next section. So, how can I use mindfulness to help me adapt to change, like a move or a new job?
I would say, these practices, as you engage with them, their benefits will unfold in your life in the way that they do. And yes, of course, adapting to change is one of the benefits that engaging in mindfulness, because what mindfulness is really about on one level is just being attentive to and noticing how much change is actually present all the time. Each and every moment, change. We, in automatic pilot, before we start engaging more mindfully, it can seem like things are always about the same. It's always just like, one thing after the other, nothing ever changes. But in fact, when you really slow down and attend to moment experience, there's all this change moment to moment. And you can bring that acceptance and awareness of change to big changes in your life as well in a very effective way. but the key is just to start practicing and see how it affects, these kind of challenges for you.
I actually have one more question for you. So, does mindfulness only work in the long term, or does it have short term benefits too? Is it something I can practice when I'm going through a tough time with symptoms and then stop when I'm feeling better?
So the idea of stopping mindfulness, is not recommended. Once you start, keep going. And, that partly points to the notion that mindfulness, as I mentioned, it's a quality that we all have anyway, and we have some of it, and we can help to build it up. Engaging in formal practice, though, can sometimes be helpful in moments of stress. It's true. Taking a few mindful moments, or a minute or 2 minutes, just to kind of really be present with and accept and experience, what is happening inside and what's happening outside. And the best time to really build your capacity for mindfulness, especially towards the beginning, is when you're not especially stressed, but just in the course of your everyday, to start building that muscle up. And then, yes, as you build your capacities, you can apply it, in the moment of a heat, of the discomfort and stressful moments more and more effectively.
All right, great. Thank you, Dr. Cahn. So moving on, we're going to move on to Alex Maizuss, our patient panel for a practical demonstration. Alex Maizuss is a globally recognized mindful prevention expert who works with individuals and groups in English and Spanish. She's certified in mindful-based stress reduction, MBRS, and mindful performance enhancement awareness and knowledge, known as MPEAK, through the University of San Diego. Alex is the first program manager for USC's Center for Mindful Science, and her meditations are currently featured in Mindful USC and Mindful Magazine. She teaches MBSR and MPEAK at insightsla.org and supports a global community through yourmindfultribe.org. Shannon has been living with juvenile rheumatoid arthritis since she was 3. Over the past 10 years or so, she has added an integrative approach to her treatment, which includes various mindfulness strategies. Shannon found a passion for these strategies, and which include various mindfulness strategies. And I just lost my place. And she's actually studied yoga and Reiki, and she tries to use those in her daily life to lessen her pain and stress. And then we also have John Kowalski joining us. He's a father of 3. He works in the Chicago Public Schools. He enjoys playing very sloppy versions of 80s college rock on guitar. He was diagnosed with gouty arthritis in his mid-20s and has been managing the condition for over 30 years now. He looks forward to learning more about how mindfulness can help with the management of gout attacks. So all welcome and thank you for joining us tonight.
Hello, everybody. Thank you for joining also, if you're with us online, joining this call. And so I thought it would be pretty interesting to follow up on everything Dr. Cahn has been sharing with us. And one of the important things to keep in mind as well is that with mindfulness, of course, is experiential as well, right? And so we can only say so much about the conceptual aspect of mindfulness. And an interesting example sometimes we use in the world of mindfulness is, for instance, if I show you this, you might have a sense of what it is. Maybe you've seen it before, maybe not. However, we can't really know what it tastes like, what it feels like, what it smells like, unless we fully engage with it. So I can describe it as just a yellow thing. It's got a sour kind of taste inside. It's mushy, it's juicy, but you won't be able to experience it until you actually take a bite out of it and notice that it's actually sour and mushy and squishy and stuff. So with mindfulness, we kind of use the same approach. is experiential. And so what I like to do really briefly is just guide you in a very short practice, as Dr. Cahn was explaining. And this is the idea that you can do this anywhere, that you can just drop in into your breath or the body. So I'll guide you in, and you can do this with your eyes open or your eyes closed. But all I'm going to ask you to do right now is tune into the way you're sitting, just becoming fully aware of how you're sitting right now. And again, you might close your eyes if you like to. And just noticing those areas of contact of the body with the surface that's holding you. So whether it's a chair or the cushion, your feet are on the ground, maybe noticing what it feels like to have your feet on the ground. And just for a moment, let's hang in here with the body, fully arriving to the moment. So mindfulness is something that needs to be experienced. And so this is it. This is our practice. And I'm going to ask you to just come in and notice if there's any tension in the body, any tightness anywhere. And seeing if that tightness wants to soften up a little bit. So maybe releasing the jaw, dropping the shoulders. You can do this by taking in a deep breath if you like. And exhaling all that tension out. So just for a moment now, noticing how you're breathing, knowing that this body doesn't need any help from you. It breathes all on its own. Just allowing yourself to be engaged in this process by paying attention to the breath. Maybe feeling the breath in the body, sensing it in the upper lip or the nose, the nostrils. You might notice that there's maybe some thinking going on. There's the wandering mind that we were talking about. So just noticing that and escorting the attention right back to either the breath, the body here, or you might even tune into sound. So becoming aware of the sounds within yourself, maybe the breath or the sounds in the room you're at. And at this moment, you don't have to worry about anything. I'm keeping track of time for you. So just hanging here with the breath, the body, any sounds that you might hear. If you notice any resistance to this, that's okay. Just noticing that, coming back once again and again to this moment, the breath, the body, the sounds. Or maybe just taking in a deep breath once again. And on a long exhale, allowing the eyes to open if they're closed. And just for a moment, noticing how you feel after that. Just short grounding meditation, coming back to the moment in this way. And so, because mindfulness is experiential, what we just practiced was a formal meditation. So there are ways to practice, and based on all the questions, I think it would be important to address that there is the formal practice, which is when we engage our attention while we're walking, while we're doing mindful movement, or while we're eating even, right? But there is also the sitting meditation, which is what we just did right now, and lying down meditation, which is based on body scans. And so, but there's also all this informal practice that we can do during the day. So with the formal practice, we're doing exactly what Dr. Cahn is saying. We're training the mind. We're training this attention muscle to become stronger. So that during the day, when you notice the mind wandering, when you notice resistance, when you notice the story about our pain, and by the way, if I may share, I'm also a chronic pain patient, so I can relate. And so when we notice all these stories, we can just right away bring the attention back. So this is what the practice does, the formal practice. But then during the day, there are wonderful ways to get engaged too. So then we have, we can get engaged in mindfulness when we're eating, right? When we're having a conversation. Somebody was asking, how can I get engaged in mindfulness through music or through dancing? And the idea is that if you're fully present, engaging all your senses in the moment, you're already practicing as well. And so with the formal practice, you can notice when you're not there, because even if we're listening to our favorite song, how long do we last really listening? Maybe a minute, and then the mind starts going into the past. And this reminds me of this, and oh my God, I love this. And so even then, we will notice that, and we'll come back to listening and being fully present. And so that being said, I think I'd like to open it up to our participants and seeing if you have any questions, anything that I can guide you with in this process.
Jim or Shannon, do you want to go first, or I can jump in? Okay, so for me, I'm like this A-type person, and I all in to everything that I'm up to. I've got a full life, so balancing work life and then being a patient who has multiple comorbidities, it really gets challenging. And then slap on COVID, it's just been like just a lot of stress. So, how can I, and then I want to practice mindfulness, but I just haven't figured out a way to really incorporate it. So what tips do you have?
Yeah, thank you so much, Heidi. That's a great question, really. With everything that's going on with the pandemic and how stressful our lives are right now, it could be kind of hard to get a start or even to notice how we can practice. And so one thing that I can say is that by just even doing the simple exercise that we just did, and so sitting for just a few moments, even just noticing how you're sitting, noticing how the clothing is felt in the body, noticing your feet in the ground if they're in the ground, and really tuning into the sensation in the body is really important. Now that becomes overwhelming because, of course, with our pain, the last thing we want to hear is that tune into the body, right? But this could be really helpful in how we relate to pain itself. So mindfulness is really how we relate to things. How do we relate to our pain? How do we relate to our stress? What is it that I consider stress? So these are some things to keep in mind. And through the practice, even through sitting 5 minutes, 10 minutes with yourself, you'll be able to know the really slightest hints of when you're stressed. For instance, you might notice body changes such as your heart beating fast, right? Or sweating, or your blood pressure going up. So all these things you learn to notice. And so at that moment you can choose. Now you have a choice to take care of yourself. Does that make sense, Heidi?
That does. And I
Yeah.
know, yeah, and I know for one of myself, like one of my cues is when my shoulders like are up on my ears, it's like I've become really stressed. So doing
Exactly. You're not alone.
back down for me. So thank you.
Yeah, thank you. You're not alone in that. Yeah.
Jim or
Any
Shannon?
other questions?
Of course. So something that I struggle with is sleeping. I've gone through various different mindfulness practices throughout the years, but finding one that I could really stick to kind of becomes a problem for me, especially at night. Do you have any suggestions for that?
Yeah. Oh my goodness. This is a really good question. Just as we speak about this, last night I had that problem. So I had plenty of time to explore and experience this. And so one of the things is just to become aware as you practice, even the simple exercise, you'll notice the narrative in the mind. You notice it, you start noticing the tension in the body. So a lot of the times when we go to sleep, what happens is that the mind is still planning, the mind is still doing. And so if I may ask you is, what happens when you can't sleep? What have you noticed?
Definitely mind racing, some pain, just not being able to fully detach from the day. Those are basically my big ones. And then, of course, the anxiety potentially of something going on the next day, if there's something going on the next day.
Yeah, exactly. So the mind going to the future, the mind going to the past, and then the pain that brings us back to the moment, believe it or not, right? It's so present. And so what we can do when you notice this and you notice the narrative in the mind, one of the things that often happens is that we start resisting the fact that we can't go to sleep. We get on the way. It's like, I have to go to sleep. Oh my God. It's like me last night. I was like, oh my God, it's an hour now, it's a half hour now, and the mind and we're fighting this fight that we cannot win, because the more it's like feeding the fire, right? Now every time we put the resistance up, we're feeding that fire, and it just becomes a battle that we cannot win. So the one thing that I would say that you can try, it's to just acknowledge that there's a lot of thinking. And so Dr. Khan was talking a lot about compassion towards the end. And this is one of the things that we can bring just compassion to this mind. There you go, planning, right? And bring a little bit of sense of humor to it, right? And last night I just can't stop laughing at it. It's like, come on, seriously, right? So bring a little bit of sense of humor and just go, there you go, planning, there you go, worrying. And we're talking to the mind. You're not even talking to you. That this is a normal function of the mind. The mind will wander, and mostly if we have a lot to do and the entire day is about planning, the mind doesn't know how to disconnect from that.
Right.
So it doesn't get the message. You're tired, it's time to go to sleep. So the more you practice the more you practice formally, the more you will notice also when the mind is racing, even before you go to bed. And so that time, maybe a mindful walk, right? Maybe a little bit of mindful movement can help before you go to bed. And also another thing that can help you is to just allow yourself to notice that you're resisting things the way they are, because we are at that moment. We want things to be one way and they're not. And this also is what brings that resilience eventually from mindfulness, because now we're, oh well, if I can put up with me not sleeping for a couple of hours, I think I can put up with a lot of things. And so we become quite resilient in that way. Does that make sense, Shannon?
It does. Yes. Thank you.
Thank you. Good question.
I had one. When somebody mentioned earlier in the earlier questions about having ADHD. Me too. And I'm at work sometimes, and I can feel, if I feel an attack coming on, like maybe the stiffness starts, or maybe the pain has even begun. I'll start focusing on that. And as you just said, Alex, pouring gas on the fire, like that just becomes this thing that I start spinning on the pain. And it isn't always the pain. It could be anything distracting me. But the onset of a gout attack, yeah, that'll grab my attention. And I'm interested in maybe if you could speak a little bit in your answer about how doctor mentioned meta awareness. And I really like this idea. I've read about it a lot, where being aware of my awareness, which is, from my understanding, meta awareness, that builds that muscle even faster. From my understanding of it, is like paying attention to what works speeds things up. Is this true, or did I just dream this or make it up somewhere?
Well, that's actually a really good question. And so when we're engaged in the practice, we can notice we kind of become the observer of what's happening. and again, it brings us back to choice, right? So you're observing now, as you were mentioning, mostly with ADHD, that the mind starts racing at that moment, right? It's already a habitual pattern in a way for the mind to do that. So every time you're stressed, talking about stress, right? This brings a lot more stress. It brings us back to that same cycle of the mind. So when you notice that, the idea is with this awareness is that now you're aware that that's happening. There's the mind rising. And then and then you notice the pain. Now, if I may ask you a question, when you notice this early triggering of the pain, or or the sensation due to the gut disease, how long would you say it lasts for you?
The distraction or the pain itself?
The pain itself, once it starts.
Oh, a few days.
Yeah.
Like
So
it just ramps up if I don't head it off with medication.
yeah. So I'm there with you on that. So I can totally relate to that. And so one thing that is interesting is that there are different ways of coping with our pain, right? And so this awareness again that you're speaking about is going to come from either zooming into the pain, which can be a really daunting idea. It's like, why would I want to focus on something that doesn't feel good, right? Nobody wants to do that. But the idea is that we go below the label of the pain. And so we start noticing what it feels like instead. So it could be sharp, or it could be dull, or it could be numbness. And then we get really curious about it. So that's one way, right? And then again, we're becoming aware of the entire process, seeing what works. And at that moment, when we start paying attention, we also realize that it seems like the pain is lasting all this time, but really it's coming and going in increments. And sometimes it's stronger and sometimes it's less. So it depends on so that's one thing that we can do. Another thing will be zooming out. So that's zooming in. Another way is zooming out. And this reminds me so much of a story with a fireman rescuing a man from a fire who had gotten injured. He broke an arm. And the man was just in terrible pain. And the fireman, he says to the fireman, help me, my arm really hurts. And the fireman kind of helps him in and brings him in. And then he says, okay, so where are you hurt? And he's like, my arm. And then he says, how is your other arm? And then he goes, oh, that arm is okay. So what happens is if we can just zoom out, the mind it tends to zoom in when there's pain. And that becomes the most important thing. That's it. And of course, it's necessary, right? Because we need to attend to this. But if we can zoom out and focus on other areas of the body, that could be helpful as well. And so now you're getting that awareness as you practice this. What works for me, right? What is it that I can do about this? Now, one more thing that I want to throw out there that could be really important with pain, it's distraction, right? But we're going to talk about distraction a different way, and it's mindful distraction. And this could be sometimes the most compassionate thing we can do for ourselves. Now, the idea is that we don't distract by impulse, right? So for instance, if a mosquito bites me, the first thing I want to do is like, oh, right? I react, right? So now the idea is that when you feel this pain, you notice it. And at that moment, right away, there's an act of compassion on just accepting my pain is here, right? So at that moment, you're already kind of mindfully monitoring your pain. So in this way, you can just go, do I zoom in? Maybe not. Do I zoom out? Maybe. What else is hurting in my body, or where does my body feel okay? Or maybe I'll just watch a movie right now. Maybe I'll take a walk. Maybe I'll call a friend. But see the difference. We're not distracting automatically. We're not doing it by impulse, because that's only going to create a habit of distraction that's not going to help us at all. But we're actually distracting consciously. We're acknowledging the pain, we're accepting it. So we're fully aware of what we're doing. And then we can even time our distraction. Does that make sense, Jim? At least some helpful things? Yeah. Okay. Thank you so much. Great question, by the way. Yeah.
Alex, thank you so much for taking the time to lead us through the interactive demonstration. And thank you, Shannon and Jim, for agreeing to be our on-air guinea pigs.
Thank you. Thank you for having me. Thank you.
I'd like to open it up to some more questions from our patients. So first question for you is, have you tried mindfulness? Wait, backtrack. I've tried mindfulness before and I haven't had much success turning my mind off. God, I didn't write this, but that's me. Are there any tips you have to help me stop the chatter and thinking while I meditate?
Well, I wish I could stop the chatter. I wish I could tell you that there's a way to do it. But the truth is that what we're doing really is noticing the chatter, noticing what's happening. So with mindfulness, we're never turning off things. We're actually quiet a bit, quite the opposite. Sorry, we are actually approaching things in a different way. We're seeing, how do I relate now to that chatter itself? Oh, there it is again. And so there's that non-judgmental component that Dr. Cahn was talking about, right? Paying attention and noticing that awareness arises. Oh, there is a chatter, but I'm going to just maybe notice where my mind went and come back to the breath. So that's all we're doing. Every time you notice that, you come back once again and again. Trying to shut it off. Gosh, if you find a way, please let me know. I think it would be very hard, but noticing could be a lot easier. Just notice that, just come back. And that, again, that in itself is an act of kindness and acceptance and self-compassion, which are very healing components of mindfulness. So I hope that answers your question.
Great. And what I hear is definitely for myself, taking in kindness and not making it wrong. So the next question we have is, I have severe pain in multiple areas of my body, and I find it difficult to shut my mind off from all these areas when I'm meditating. Any tips?
Yeah. So again, it goes back to that idea, or the fact that when there's pain, the mind is going to focus on it. And so I think what would be useful is to try some of the things that we were talking about. Maybe trying the zooming in, and that most of the time we want to find out the front door if we say zooming into pain. But really seeing if we can play around with the idea. The idea is that we can see, how am I relating to this pain? This is what was causing much of the suffering. That there's always story behind it. I used to be able to do this, now I can't. Now what am I going to do with this pain? I have to get up tomorrow and do this, and now I'm not going to be able to do it, right? And so all these things are important to be noticed, because this is how we're relating to pain, and this is creating that resistance again, and adding more to that fire, as we were saying. So just noticing that and coming back, and maybe a thing to do will be seeing if you can tap into something else. So zooming out, noticing sound, noticing the breath if that's accessible for you, or noticing the areas of the body that are not hurting. So that could be helpful. Yeah.
Okay.
Thank you.
Great. Our next question, is there a best time to meditate? Morning, evening? Can you break meditating up into chunks throughout the day? Or is it better to meditate longer at once?
Yeah, this is a question that comes up so much during that 8-week program that Dr. Cahn was talking about, because we require a 45-minute body scan a day. And so now I personally believe that a little bit better is better than nothing. So if you can break it down during the day, if it's impossible for you to sit there, and sometimes to begin, it could be daunting to sit there for 45 minutes. And so I always say to class participants, aim to the 45 minutes, but if you can do 10, 15, do that. Because if I say only do 10, we're going to do 5. That's just how the mind works, right? If I say 5, we're going to do 1 minute. And so really noticing that, where are you at? And then if you can do increments, that's fine too. So practice is better than no practice. So do something instead of nothing. Yes, definitely. Thank you.
Great. Our next question is, what are some mindfulness practices or techniques for morning to help set up the rest of my day? Mindful eating breakfast, shower meditations, stretching on the bed?
Yeah, good question. I think this goes back to what Dr. Cahn was saying again about, it's very individual of what works for you. And so maybe what might work for you will be, as you said, stretching. As soon as you open your eyes, do that stretch, feel the body, kind of wake up to the senses in the body as you feel the stretch. And then and I think you answered your own question, by the way. Eating will be a good practice too. But if you can just do a little bit of formal practice in between will be nice. So as you're stretching, maybe tune into the breath, just noticing the breath, or noticing, sometimes for me, I can hear the birds outside and I'll just tune into the birds for a little bit. And this is again, creating space in between the thoughts. So we're creating space so that our life is not so stressful with so much thinking, so much narrative, so much story. And so just finding what works for you, but really tuning into the moment as you go throughout the day is ideal. But what works for you is, I think, the best way to do this. Yeah, thank you.
So the next question, my pain makes me anxious and sometimes causes panic attacks. What are some tips to help me from spiraling?
Yeah, you're not alone on that. So let me tell you that. It's adding another layer. We have this say that we constantly share in mindfulness, and it's like the double arrow theory, right? There is the first arrow will be, wow, there is pain, and we acknowledge that. The second arrow is, oh my God, there is pain, and there's more pain, and there's more pain. And now it's like what I was saying, the story of the pain. And so that can really agitate us. And you're not alone on this, as I was saying, because the more we think about it, the more we get anxious and nervous. So one of the things that I would say that you can try, and this is again very individual, without asking questions, I can't really answer this. So I'm going to make it very general on these answers. But one of the things that you could try is just see if you can just stay with the pain, which is the arrow one. So when you notice the mind kind of going into the scenario of what you're not going to be able to do, or how much it hurts, or not what is going to happen tomorrow, it's always going to go from the past to the future. When you catch that, come back again to the moment, and then you can use again, the zooming in, zooming out, or maybe even the mindful distracting. So these are some things that you can do. And this is why the formal practice that we were talking about, the actual sitting and breathing and tuning into the moment, could be very useful, so that we can track when that panic attack is coming in. A first sign. So otherwise we don't even notice it. So it's really important to really taking that time to do a little bit of the formal practice as well, so we can be more in tune when that happens. If that answers your question. Yeah.
Great. Our next question is, what are some resources you'd recommend to get started? Apps, online meditation groups?
Yeah, and again, whatever works for you. I think it's so much easier because everything is on Zoom, and you can find some wonderful live classes. You can participate in groups. You can build community with others. And in my experience, practicing in community can be really helpful on supporting each other and creating that, practicing with like minds that are doing the same. And that goes again to addressing even the question of like, what do you do when others at home are not practicing? Doesn't matter. I have my community I practice with, right? that kind of idea. And so that could be helpful. But whatever works for you really it's what it is important. So try different things and see what happens. Also, a really useful thing will be to really take a class if you're new that gets you started. Whether it's 5 weeks, whether it's 6 weeks, whether it's 8 weeks. Really register and really committing to the time, as Dr. Cahn was saying, could be really important as well. Yeah. Thank you.
Great. Our next question. What are your thoughts on hemi-sync meditation by the Monroe Institute for Pain or Stress?
Yeah, I'm not very familiar with that, but maybe Dr. Cahn can talk about that, about the Monroe Institute. Yeah.
I can just, chime in that I have heard of it, and it's one of these, it's like an auditory constructed sound that involves, it's an interesting sound technology that they use, where the two ears are hearing slightly different frequencies, and it's called the binaural beat phenomena. The difference between those two frequencies, the brain is stimulated to kind of activate at that frequency that's in between the two frequencies the ears are hearing through some interesting auditory neurophysiology. So we do know that, yes, it affects the brain in that way. It can kind of stimulate some particular rhythms of the brain, kind of slower rhythms of the brain that we sometimes see happen with meditation, although not always. And that's kind of why it's, theoretically thought to work, is that it's somehow stimulating these frequencies of the brain that you see sometimes in meditation. And I answered this also via text, but I think the questioner wanted to hear your experience with it, Alex, so asked it again. But what I can say is, there's not a lot of research that has shown, in a kind of large clinical trial that this is something that benefits people. But of course, it could be quite beneficial and just hasn't been researched enough for us to know. As with many of these things that can help promote deep relaxation, if that particular modality does help promote relaxation for you, then I think that's great, and it probably is, a tool to use, because deep relaxation can be a really beneficial thing for everyone. Of course, mindfulness practice is a little different from just relaxation. As we've been discussing, the key to mindfulness practice is that keeping an alert mind and brain while also engaging in this kind of, capacity for turning attention towards sensation and away from the, incessant engagement with thinking. And, when you relax and your thinking kind of goes down and you tend to start kind of going into this daydreamy, sleepy state, that can be helpful, but it's different from that very clear, awake awareness that mindfulness practice is really aimed at. So I think that they could both be helpful, but to say that they're the same would really be probably confusing the issue.
Thank you.
Thank you. So Alex, another question specifically for you. Where do you teach classes?
I'm sorry, can you repeat that? It cut out a little bit. Zoom.
Where do you teach your classes?
Where do I teach my classes? So I teach at Inside LA, and I also lead a group that is free during COVID. I've been leading it since last year, called yourmindfultribe.org. And I see a lot of the people from Your Mindful Tribe actually are tuned in. So hello, everybody. And this is free for everybody. You can come in. We meet every Monday and Friday. It's at 11 to 12:30. So we do formal practice, a guided meditation, and then we also engage in practice informally in small groups and discussion. So everybody's welcome to that. Yeah.
And
those would be the main places. Sorry.
And I assume that's Pacific time, correct?
Yeah, 11 a.m. Pacific. Yes, Pacific time. Correct.
Right.
Yeah.
Awesome. Well, Dr. Cahn and Alex, thank you both so much for lending your expertise and your time tonight. You've equipped us with, God, so many tools that we can add to our toolkit to start, being effortless meditation practices on our own. So thank you again for your time. Before we sign off for tonight, just a reminder, we have several resources and events coming up to help you manage your arthritis, including next week's webinar on Wednesday, February 2nd, and it's about the evidence and safety behind using medical cannabis to manage your symptoms. You can register for the webinar and others at arthritis.org/webinars. We also have our Advocacy Summit. If you haven't already registered for our virtual Advocacy Summit on February 22nd through 26th, attendees will participate in exclusive sessions covering topics such as being an advocacy leader, health disparities, continuity of care, pain management, and more. Visit arthritis.org/advocate/action center. Our Arthritis Foundation also hosts our Live Yes podcasts, and they bring you the latest in disease management and treatment. As a companion to tonight's presentation, visit the emotional well-being section at arthritis.org/liveyes/podcast for more episodes on how to use mindfulness to combat stress. Our Live Yes Connect groups are local peer-led support groups that provide connection, education, and empowerment to adults living with arthritis and rheumatic conditions, and also parent and caregivers of children living with arthritis. By joining a Connect group, you have access to an understanding and supportive community of people just like you right in your community. We send out notifications when we have events coming up, and all of our groups are meeting virtually right now. Our companion to that is our online community, which is a series of interactive online forums where our members can exchange ideas, tips, and experiences with others on a variety of topics. This community includes disease-specific discussions, hot topics, and more. Our volunteers make this a warm, friendly place for people to connect from the comfort of your home 24/7. Our helpline. You can call the Arthritis Foundation helpline, a toll-free number, to get the support you need from our helpline specialists. You can call 1-800-283-7800 for personal solutions to your arthritis issues. You can also ask your questions and submit them online at arthritis.org/I-need-help. Like we mentioned before, taking just 10 minutes to fill out our insights assessment can help lead to more effective care for adults living with arthritis and develop programs that meet your community needs and shape a powerful agenda that fights for you. Please visit arthritis.org/liveyes/insights to take this assessment. So we've had a great agenda today. And as a closing reminder, please note that in a couple days, you will receive a survey asking about your experience. Please take the time to fill out the survey completely and honestly so we can best serve you in the future. Your feedback helps us to improve education events to help you with your needs and wants. So thank you for joining us tonight and take care. Have a wonderful evening.